Some other big news today. Dr. Rick Bright, who was formerly the head of BARDA, which is a key federal office in charge of vaccine development, he has formally filed a complaint with the Office of the Special Counsel, alleging that he was ousted from his position, moved to a narrower position at the National Institutes of Health in retaliation. In retaliation for what? He explains, Jake, that it's because he resisted efforts to push hydroxychloroquine, a treatment that President Trump repeatedly promoted from the White House briefing room. And Jake, in this lengthy 90-page complaint, he also talks about the fact that he tried to sound the alarm early on, including in June, about some shortages of critical medical supplies, including protective equipment like masks, as well as testing equipment like swabs, for example. He describes numerous instances and provides emails as well to back up some of his accounts, in which he explains that leadership at HHS, including his direct supervisor, the Assistant Secretary for Preparedness and Response, Dr. Robert Kadlec, Bright alleges that Kadlec and others repeatedly downplayed his concerns about some of these shortages. Of course, Jake, we know since then that many of those shortages were indeed a critical part of the story of this administration's failures at times to properly respond to this coronavirus pandemic. On a call with reporters just a little while ago, Jake, Dr. Bright said that he was pressured to let politics and cronyism drive decisions rather than the science. Jake?
That's right. The FDA has since warned doctors not to prescribe, individuals not to take hydroxychloroquine unless they're in the hospital or part of a clinical study. Jeremy, the White House says that there are multiple reasons why Dr. Bright was removed from his post, and obviously they don't agree with his description. What is the White House saying?
That's right, Jake. Look, the official side of the White House and the Department of Health and Human Services on this specific complaint, they have so far declined to comment. But in reporting on Dr. Bright's initial allegations, which surfaced a couple of weeks ago, we uncovered reporting sourced to administration officials familiar with the situation, who said that Dr. Bright mistreated staff. They allege that he mismanaged his office. And in fact, several sources told me that they believe that Dr. Bright was in fact slowing the response to the coronavirus rather than speeding it up. But what is clear, Jake, is that this is going to continue to be a story for weeks to come. Keep in mind, Dr. Bright here is alleging that his ouster violated the Whistleblower Protection Act. And we are also just learning from Dr. Bright's attorneys that Congress has scheduled a hearing. Congresswoman Eshoo has scheduled a hearing for May 14th. Sorry, I'm just getting this information on my phone now. For May 14th, and Dr. Bright will indeed be testifying.
Dana, let's go back to the other breaking news. Dr. Rick Bright, formerly the top vaccine official at HHS, now filing a whistleblower complaint over his reassignment. He claims that his warnings about coronavirus, about the lack of PPE in the stockpile, were met with, quote, indifference, which then developed into hostility. How much does his complaint center around his caution at hydroxychloroquine, the drugs that President Trump was pushing?
Well, it's all the above. And as you know, he says that the reason why he was removed from his post ultimately was because people who were his superiors were worried that the president would get mad because he was saying that the president's claims about that drug were false, which of course, turned out to be accurate. The FDA said, no, that drug should not be used for COVID-19. So look, I mean, the good news here is that this is how the system is supposed to work. He filed a whistleblower complaint. The inspector general will look into his firing and whether or not, or removal, and whether or not there were other factors. As you just heard Jeremy say, White House and other administration officials insist there were, like personnel issues and other problems that he had separate from his response to coronavirus. We'll now hear it on Capitol Hill, where he'll be under oath, and the inspector general. And so we'll actually have a real independent investigation to get the questions that you just asked answered.
And Sanjay, Dr. Bright says he started sounding the alarm about the virus in January, and he warned the U.S. wasn't prepared if the virus made it over here. He says when he started issuing those warnings, quote, Secretary Azar of the Department of Health and Human Services and Dr. Kadlec responded with surprise at his dire predictions and urgency. Assuming that's true, what does it say to you when a top vaccine official comes out and says the government's top HHS officials were surprised when he was warning them about the pandemic?
Well, I would look forward to these hearings, Jake. I mean, to be fair, I think Secretary Azar, when we were doing some digging into this, there were some, warnings that the secretary gave as well. And this 90-page letter, I started to make my way through it. One of the big things that he says, Dr. Bright, that he was pushing for the genomic sequence of the virus to be released to the United States on January 10th to no avail. Well, actually that weekend, January 11th, January 12th, is when the sequence was released, according to some of our reporting. So, I mean, there's a lot in this letter, but I think there were people who were sounding the alarm besides Dr. Bright. I think how exactly that information flow went, how high did it go? I don't know, but I do know, from some of our reporting, again, Secretary Azar initially did voice some concerns about what was happening and had talked about the idea that this novel coronavirus could spin into a pandemic. No one was calling it a pandemic, obviously. In fact, we were the first really at CNN to call it a pandemic March 9th. But there was concern that was voiced by some senior leaders at HHS. So I'll be curious to see how these hearings sort of transpire.
Dana, there's also some new reporting today in the Washington Post, which says it obtained a complaint from a volunteer who worked with Jared Kushner's coronavirus response group. This is a group of volunteers from the financial consulting world and others. This volunteer says many of the people working on the pandemic response had little experience actually doing the tasks they were assigned, and that often they failed.
Yes. Look, I mean, this would not be the first time there was a complaint that the people trying to do jobs in this administration were doing them blindly because they don't have the experience that most people historically have in these jobs. The specifics on this, everybody's going to have to dig into to see how accurate those complaints are. But again, there's been a lot of criticism along these lines in general across the board since the White House, since this president was sworn in.